So today, we are digging into a massive public health initiative from England, the NHS Diabetes Prevention Programme. Now, we already know it's designed to make people healthier, but a really fascinating new report from the Office for National Statistics started asking a slightly different question.
And that's it, right there. That's the big question at the heart of this entire explainer. Does an intervention that's all about improving our physical health, does it also end up boosting our financial health? It seems like a simple question, right? But believe me, the answer is way more complex than you'd think.
Okay, so here's our game plan. First, we're going to cover the basics of the program itself. Then, we'll look at how the researchers actually set up this huge study. After that, it's time for the two big verdicts: what happened with people's earnings and what happened with hospital visits. Then, a super important word of caution before we wrap it all up with the bigger picture.
All right, first things first, let's set the stage. We're talking about a nationwide program in England that was designed to tackle a really big problem: the growing risk of type 2 diabetes. So what is this DPP thing exactly? Well, you can think of it as a 9-month intensive course on changing your lifestyle. People who are identified as being at high risk get all this support to help them manage their weight, eat healthier, and just get more active. And here's the key thing. We already know it works. Other studies have already proven that it really does reduce a person's risk of developing diabetes. The health benefit? That's a given.
And that brings us right to the heart of this new study. We know it helps with people's health, but does it help them stay in a job? Does it help them earn more money? That was the big unknown that these researchers really wanted to get to the bottom of.
So you have to wonder, how on earth do you even begin to measure something like that? Well, you need a seriously clever experiment. And that is exactly what the ONS and their partners put together, by linking up just a massive amount of data to get a really clear picture. Now, this is the really clever part. To figure out if the program worked, they needed something to compare it to. So they took a treated group, that's almost 40,000 people who actually completed the program, and they compared them against an untreated group, over 20,000 people who got referred and assessed, but for whatever reason, never actually went to a single session. This setup is what lets them try to isolate the effect of the program itself.
And here's where the magic happens. This shows you the incredible power of this study. They took 3 gigantic anonymous datasets and linked them together. You got the NHS data on who actually went to the program. Then they linked that to the tax office records to see what happened to their earnings. And then they linked that to hospital data to see if they had any unplanned admissions. I mean, they followed these people for up to 5 years. It is an unbelievably detailed picture. So, the experiment is all set up, the data is linked, it's time for the first big reveal. What did all of this tell us about people's finances?
And there it is. The bottom line is, when they looked at the group as a whole, the program just didn't seem to cause any kind of boost in their earnings or their chances of being employed over those 5 years. I mean, for a program that's supposed to improve health, to help people work, that's a pretty surprising result.
But, of course, it's never quite that simple, is it? When the researchers started digging deeper into the data, they found a little glimmer of a different story. It turns out, for the younger folks in the program, there was some evidence that after about 4 or 5 years, their earnings started to recover and even climb above where they were before. So, no big overall effect, but maybe a long-term positive for that specific group.
Okay, so the economic picture is, well, it's a bit fuzzy, right? But what about the direct health impacts? Beyond just preventing diabetes. This is where the story takes a really clear and, frankly, very positive turn.
And there's that number again, 4 to 5 years. 4 to 5 years after completing the program. What do you think happens? What shows up in the data that points to a real health benefit? This right here is the other huge finding. 4 to 5 years down the road, there was a real noticeable drop in emergency, unplanned trips to the hospital for the people who completed the program. And this was especially true for the older participants. This points to a genuine, long-term health boost that also, by the way, takes a lot of pressure off the healthcare system itself. Now, before we jump to any final conclusions, the researchers themselves put a very big, important warning label on their findings. And it's really crucial that we understand the limits of what this data can actually tell us. And they put it right there in black and white. See, they noticed that a lot of people in the study already had their earnings going down before they even started the program. Because of that pre-existing trend, it's really tough to say with 100% certainty that the program caused the results they saw. You know the old saying, correlation isn't causation, and they are very upfront about that.
Okay, so keeping that caution in mind, let's pull all these different pieces together and try to figure out what the main takeaway is from this incredible piece of research.
You know, if you were to boil it all down to a simple scorecard, it would probably look something like this. When it comes to the direct economic impact, so earnings and jobs, there's no clear win. But for the long-term health impact, which we can see in those fewer emergency hospital visits, there is a definite positive effect.
And I think this pretty much tells the whole story. Maybe we've been asking the right question, health versus wealth, but we've been looking for the answer in the wrong column. The real value of a program like this might not be about boosting individual paychecks right away, but about creating a healthier population that needs less emergency care over the long haul.
And that really leaves us with one final huge question to think about. If the real benefits aren't just about money, but they're about well-being, about quality of life, and about a healthcare system that isn't constantly under pressure, well, how do you put a price on that? It kind of suggests we need a much broader way of thinking about what we get back from investing in public health.